New at 4, more hospitals are joining the White House in calls to end gender-affirming care. Starting tomorrow, Children's National will stop prescribing medications for transgender students and children. Supporters call the move a necessary step to protect children's health. But critics argue that is yet another example of hospitals bowing to federal pressure. Matthew Torres is live at Children's National in Shaw. And Matthew, you spoke with a Virginia teenager who's relied on these services for years. What happens now?
Well, the family was really left scrambling, trying to find another option. Children's National Hospital announced that starting tomorrow, it will no longer be prescribing, monitoring, and recommending what's called gender-affirming medication.
What did I do wrong? Other than be myself.
16-year-old Eleanor Bowling says she's living life authentically as a trans girl. Her father says her transition was not a spur-of-the-moment decision.
It was years and years of therapy and counseling, and the entire family was involved, and there was lots of prayer and discernment and counseling and the community involved.
Eleanor has relied on gender-affirming care from Children's National Hospital for 5 years. That includes puberty blockers and hormone replacement therapy, which she started within the last couple of years.
The way I do blockers is that I have a small implant in my arm that lasts 3 years, and I got that this January.
But the family says they were forced to find another provider after Children's National sent this email last month. It says starting August 30th, the hospital is no longer providing or recommending the same medications Eleanor needs, citing, quote, escalating legal and regulatory risks.
If I don't have estrogen to take, I have no hormones going through my body and I can't grow.
At all, which is like actually life-threatening.
The move to end gender-affirming prescriptions comes as President Donald Trump threatens legal action and withholding federal funding through an executive order. The family says after one hospital in Virginia couldn't take any more patients, they landed at Whitman Walker in D.C. to continue treatment.
This is about, we don't want to spend the money on the lawsuits and fighting this administration because money is more important than patients and people.
But Children's National is still offering mental health services to trans children and their families.
I knew these doctors. They're very kind, very caring. I'm worried for them and I'm worried for me.
It's also unclear exactly how many people were relying on these services from National Children's Hospital. We do know that this hospital is now one of at least 21 hospitals across the country to backtrack their gender-affirming programs.
Well, and of course, Matthew, the next part of this story will be what does this mean for the families and where do they go now that more hospitals are saying that they will no longer provide this care? I know an update that you'll be providing us with. Matthew, thank you so much.